Hi everyone, welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and host of the Dean's Chat podcast. Our goal, as always, is to bring you current and future leaders in our profession, and today is no exception. My guests today are from the Arizona College of Podiatric Medicine, longtime faculty member Dr. David Jenkins, and second-year student Alicia Stevens. Dr. Jenkins needs no introduction in the area of sports medicine. He has served as a past president of the American Association of Podiatric Sports Medicine. Today, however, we're going to discuss his significant involvement and contributions in the Special Olympics. Most notably, his recent visit to the Special Olympics World Summer Games in Berlin, Germany. We'll also discuss his recent contribution to the American Academy of Developmental Medicine and Dentistry. This is an organization dedicated to individuals with intellectual and developmental disabilities with an acronym of IDD. Ms. Alicia Stevens is a second-year student at the Arizona College of Podiatric Medicine. She is the president for the American Academy of Developmental Medicine and Dentistry at all of Midwestern University. She is also the president of the American Limb Preservation Society at the Arizona College of Podiatric Medicine. Welcome to Dean's Chat, Dr. Jenkins and Alicia.
Thank you very much. Thank you.
You know, the way I thought we'd get started, Alicia, if you don't mind starting, is give us a little history of your background, your educational background, how you discovered podiatric medicine, and perhaps how you ended up at the Arizona College of Podiatric Medicine.
Sure. So I graduated from Adrian College way back in 2018 now. I always knew that I wanted to be in the medical profession. I loved working with patients and studying medicine. So I took a few years off as a gap year, and I worked at multiple clinics, and I actually didn't know about podiatry in college. So my mentor actually brought up podiatry to me, and that's when I started shadowing. I shadowed Dr. Cohen back in Michigan, and I really liked it. I liked how hands-on it was. So I actually took a position at Dr. Cohen's office as a medical scribe. So I got to work there for a few months and see how amazing podiatry is. And I just love that you get to work with so many different kinds of patients. And then, so for school choices, I looked into all of them, all over the country. I didn't want to, not look at any, or, I wanted to keep a broad base. So I knew that from Dr. Cohen that AZCPM had really good academics, and they also had a lot of good clinical opportunities. So that was big for me. But what really sold me on AZCPM was Special Olympics. My interview was actually with Dr. Jenkins, and my student interviewer was with Montana, and they're both super involved in Special Olympics. So I was like, oh, wow, this is perfect for me. It's everything that I'm looking for. That was huge.
Well, that was a fantastic segue into Special Olympics. A little shout out to Dr. Cohen. He's no stranger to the Dean's Chat. He's been on the show with me too. He's a phenomenal doctor, and he runs a great recidency program. And two of our students are heading there, starting residency next week.
Yeah, so that's awesome.
That's great. Well, thank you, Alicia. We'll circle back around in a minute. So, Dr. Jenkins, you've got quite a bio, and I'm sure a lot of that will come out in this discussion. But what I wanted to talk to you about were the World Summer Games for Special Olympics in Berlin, Germany, because you were the recipient of the highest honor within the Special Olympics for health professionals, receiving the Global Golisano Health Leadership Award, and you can see the trophy right there. Can you give us a little bit a story about what it was like in Germany, representing the United States and Special Olympics globally, and what it was like to receive this award?
Sure. Thank you for having us. This is really kind of already a lot of fun. And yes, I found out about this award from Gianna and Jamie, who are both represent Special Olympics Arizona, who I found out they're the ones that nominated me. And we can go back later and talk about my involvement with Special Olympics Arizona Arizona. But so they're the ones that kind of got this ball going. And so what it ended up happening was I was able to travel to Berlin for the World Games. I had been to the last 7 World Games to work, actually oversee Fit Feet at these World Games, where we'll see thousands and thousands of athletes from all over the world, 160 countries. But this trip was purely for the award, and I got to join 6 other recipients from all over the world. I was the North American representative for this award, and they were all fantastic people, as you can imagine. Some represented organizations as opposed to just an individual. I was an individual, but they represented organizations that contributed incredible amounts to Special Olympics. One example of that would be a gentleman, Matar, who was from Abu Dhabi, and he was instrumental in getting the UAE, United Arab Emirates, to be really bought into Special Olympics and inclusion and change things significantly in that country. So he was one of the recipients that I got to hang out with. And they took us on a tour of Berlin. Those who haven't been to Berlin, the history is incredible, and I could spend the rest of the show talking about Berlin, but I won't do that. But that's what it was. And I guess to summarize, when I gave my talk for the award reception, what I really brought out, which I feel is the most important reason I got this award, is the students. The students at Arizona College of Podiatric Medicine couldn't do the things that I've been able to do, research, the events that we do, all those things without the students. And of course, I was very thankful to Arizona, Special Olympics Arizona, for nominating me.
What a phenomenal achievement, and congratulations.
Thank you.
On behalf of the entire university. I mean, it's just incredible. So
thank you.
Well done. So some other things have kind of fostered out of Special Olympics. I want to spend a lot of time talking about Special Olympics within the college here in a little bit. But Alicia, I wanted to touch base on your keen interest in intellectual and developmental disabilities. Where did you get that interest that would stimulate you to choose the Arizona College of Podiatric Medicine because of our involvement with Special Olympics?
So 7 years ago, I met an amazing person. His name is Matthew. He is my husband's brother, and he has Down syndrome. And just from the beginning, we just bonded and connected so easily. So he was my big inspiration for it. And I actually started off volunteering with Special Olympics through their opening eyes. I worked at an eye clinic back in Lexington, Kentucky, not many years ago, but a couple years ago. And I thought it'd be cool if we all went and volunteered at the Special Olympic Games doing eye exams. So that was my first healthy athletes experience, and it was really fun. We got to do eye exams on all the athletes, and I got to help the athletes pick out some glasses and sunglasses, and I just really enjoyed it. And then since then, I've done a couple of events back in Michigan with Special Olympics, but those just with Matthew and the Special Olympics games, I just knew coming here. And then with talking with Dr. Jenkins in Montana, and she was super involved with it. And I was just like, I want to do this too. And that's kind of where it all started.
Well, it's interesting because timing is everything, because not only coming to the Arizona College did you get involved with Special Olympics, but with the introduction of the American Academy of Developmental Medicine and Dentistry at the university, the timing was right, and now you're the current president.
Yeah.
David, could you give us a little history on the American Academy of Developmental Medicine and Dentistry and how the university got involved?
I'm going to just kind of go back a little bit, and going back to one of our former students, Sarah Kubik, who is second-year resident in Illinois right now. She was the very first of what I would call Special Olympics Arizona liaison, and that's a student who represents her class and kind of gives out all the information about Special Olympics, sign-up sheets, and just general organization. And then to follow her was Morgan, and Morgan is, I think, going to be in Denver in residency. And Luke's. Morgan was instrumental because she was the liaison during COVID, and we couldn't see athletes in person. So she helped set up an entire virtual Healthy Athletes event where we did everything online. She had 4 or 5 of her classmates, all of them, like Tiffany and and Cassie and whatever. And so we all got in line, and basically it was a triage for the athletes. We asked them lots of questions, and it was very educationally based. And so that was a huge endeavor that she did. And she actually won the service award for our college this past graduation for, I think, a lot of that. The other thing that she did was she helped organize the vaccination clinic at Midwestern University clinics. Really big deal. She's sitting in meetings with our president, Dr. G, and so I was very, very proud of her. And then the next liaison was Montana, who Alicia just mentioned. And Montana, on the side, was teaching us ASL. She's an ASL teacher. And one day she came in and she brought Alicia into the meeting with me. I never met Alicia. I kind of knew that I interviewed her maybe, but it was like, and she said, I want to be involved in Special Olympics. So I said, boom, you're the liaison for your class. And that's kind of how it works. Student Reagan was the same way. She came right up at when the faculty are introduced to the new class. And after that was over, she knew I was involved in Special Olympics. I want to get involved. So anyway, that's how it got started with the liaisons. Montana got together with a dental student, same class, it'll be a fourth year dental student. And they went through the whole process of getting a student chapter of AADMD for Midwestern University. And it's not just podiatry, but it's for the entire university. And it has since taken off like you can't believe. Again, Alicia is the president now. She's had 2 awesome events. Maybe I'll let you talk about those events. I don't want to steal the thunder of that. But that's what it is. It's a student chapter, and it's something that we're really, really proud of, because so many of the other programs showed up at one of our events saying, I want to be part of this too. Things like clinical psych and pharmacology. So really, really happy about it.
Well, let's talk about those events, Alicia. And also, let's not forget to talk about the trip to Denver, where you represented the college and presented a poster on some research.
Yeah, sure. So our first event was we had Dr. Muldoon come in and talk, and she is the course director for the humanities class for the DO students. And she came in and gave a presentation about working with patients with disabilities, intellectual and physical. So it was really cool to be able to get her perspective on how to best communicate and treat those with intellectual disability. And then our second event was for World Down Syndrome Day on March 21st. And we had a mismatched sock contest for the entire school. And we had first, second, and third place winners. The mismatched sock represents the extra chromosome that Down syndrome patients have. So that was really fun. And then we actually also recently had Special Olympics Arizona come in and gave a presentation on their new project called Lead the Field. And with that starts in the fall. We'll be getting paired up with an athlete, and each month we're going to meet with them and discuss a topic, or we're just going to play games or just get to know them, and that's going to be a great way to get more involvement with Special Olympics. So I'm really looking forward to that. And then in Denver, that was over break, we got to present our poster, which basically was on our curriculum here at AZCPM and how we learn about patients with intellectual disabilities and how to communicate with them, and just how we want to spread this to other schools and other specialties. And that's really the big message. And it was amazing to be able to present that to a bunch of people who are also really passionate about it.
So tell me about the trip to Denver. This was a national conference, and you presented this poster that got accepted, and then Dr. Jenkins asked you to do the presentation.
Yes, I was very nervous.
That's fantastic. Congratulations.
It could have gone either way, and she said, I want to do that. And there was like 100+ people in the audience, and I mean, I was nervous, and she just got up there and just knocked it out of the park. I was so proud of her presentation. And it was 12 of the posters were picked out of maybe 60 or 80 or whatever, and ours was picked, and it was a short presentation, but it went really well and got lots of great feedback. And it's one of the big topics right now, not just for us, but for, I guess, the ID community at large and medicine at large, is to come up with a curriculum that helps medical, and not when I say medical students, it's all healthcare providers who are going to interact with ID people. You take clinical psych, they probably have really good communication aspects to their curriculum. Med students, not so much. They really don't. And so we want to encourage that. We want to come up with a curriculum that's multidisciplinary, and Midwestern's the perfect venue for that, because we have 20 programs, and many of them are all interested in contributing to that. So speech therapy is another one that was very interested and very apropos to what we do.
Well, I can tell you from the curriculum guide from the American Association of Colleges of Podiatric Medicine, curriculum on intellectual disabilities, I think it needs to be implemented. And so kudos to you for developing that. I'm sure that'll be extremely well received. How far along are you in developing this curriculum?
Halfway? It's hard to say. Yeah, just as a background, how it started was just a simple lecture I gave in Dr. Violent's course in pediatric orthopedics, where we just cover the medical conditions and the associated lower extremity pathology, and that was it. There was nothing about communication, and that was the big missing link that we've been continually trying to improve and make better. How do I interact with someone with ID? You know, if you're the athlete and Alicia's your mom, I don't go, so how's Jeff doing today?
Right.
That kind of stuff. So
Sure.
We're really trying to change how people interact.
Oh, that's incredible. Congratulations. And congratulations to Alicia for leading the charge at Midwestern University.
Thank you.
So David, let's go back a little bit. Let's talk about Special Olympics in general.
Okay.
Obviously last week was a culmination of a very long time and a lot of dedicated time and service to Special Olympics. So how did you get involved originally? And what year was it? And then what does that path look like in the last almost 20 years?
I'm going to just do a little bit of history and cut me off if I get too far.
Go ahead and go.
Special Olympics, for people who may not know that much about it, was started by Eunice Shriver Kennedy. She was one of JFK's sisters. She had a sister, or he had a sister as well, named Rosemary. And Rosemary was intellectually disabled. And what Eunice Shriver Kennedy saw was tremendously, just terrible attitude that the public had toward people with ID. They were shunned. They were put in institutions. They didn't get the proper care. Just across the board was just dismal. And so Eunice Shriver Kennedy decided to do something along the lines of getting things for them to do, to get them included into the community. So Eunice Shriver was very active in sports, quite an athlete herself, and she thought, well, sports is going to be the way to do this. So she opened up her home, which is a huge Kennedy compound, as you can imagine, and they called it Camp Shriver. And Camp Shriver is where all these intellectually disabled persons were bussed in. Sadly, most of them were from institutions, because that's the way it was in the 50s and 60s. And they came, and it was basically like a summer camp. And so all the things that kids would do at summer camp, swimming and biking and horseback riding, all that kind of stuff. And it was just the first go at Special Olympics. She eventually evolved that into a competitive situation like the regular Olympics. And that first event was in 1968 in Soldier Field, Chicago. And it's been continuing since, as you know, just all the way up to the World Games. Now, where that changes is when she took her sister, Rosemary, to the dentist for some just regular dental care. And the dentist said, well, this person just has ID, we'll just pull all her teeth out. And so she said, that's not going to happen. That's terrible. So she found a pediatric dentist in Boston who specialized in that. And he said, we don't need to do that, and basically did dental care and just like you or I would have nowadays. And so she told, and this was Dr. Steve Perlman, and he said, or she asked him if he would be willing to start a health program within Special Olympics, separate from competition, but where the athletes could be screened for all sorts of medical problems, like Alicia mentioned, eyes, vision checks, dental checks, hearing checks, checks to see if bone density is okay, blah, 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 all that kind of stuff. In 10 years, and that was 1963. 10 years later, I'm sorry, 93. It was 93. 10 years later, in 2003, Fit Feet was born.
Wow.
And so that was, they decided, and this was through the Sports Medicine Academy, that someone from Special Olympics approached Rich Boucher, very, very famous, one of our colleagues, and said, we'd like to include a foot screening in healthy athletes, which is what this was called. And so he kicked it to Pat Noonan, who was the very first global clinical advisor who started it in 2003. And the rest is history. And just really quickly, what we do in a fit feet exam is we check a lot of biomechanics. We check structural deformities. We do a lot of dermatological evaluations. We watch gait. And I'm very proud to announce that now we're going to start looking at risk for diabetic foot ulcers. That's brand new. And I mentioned that in my speech in Berlin, and people were just cheering about it because they know, the people who are involved know that persons with ID have a 5 times greater prevalence of diabetes. So anyway, that's the quick view. So Fit Feet is what we do. That's what my students help me do. And so now we get back to your original question, and just, again, cut me off.
Let me ask Alicia a question.
Sure.
Alicia, what's your favorite part of Fit Feet?
Ooh, that's a tough one. My favorite is just interacting with the athlete, I think. I love, practicing and getting all the hands-on clinical practice is great, but just being able to chat with the athlete is super fun.
Very good. Sorry, David, I didn't mean to cut you off.
No, that's excellent. I need to take a breath, get excited about this stuff. We both have so much passion. I think it's just amazing with this. But my history, in 2005, a gentleman podiatrist down in Tucson, Dr. Friedrich, he had been doing all the Fit Feet exams in Arizona by himself. I mean, literally, he got no help. And he knew that the school had just started, and he got a hold of me and said, I'd like to see if you could maybe get some students to an event that we're going to have up in Mesa. So I got about 8 or 9 students. Joanne is one of them, and Aaron Martin, were some of the first people, who are very successful practitioners now, by the way. And so we went to the old Hohokam Park, where the Cubs play spring training, and we saw maybe 30 athletes. And I said, I want to do this. I want to be a clinical director. And Dr. Friedrich was happy about that because I think he was about ready to retire. And so I got my clinical directorship at Iowa State University, which I just moved away from, which is ironic. And so I've been a clinical director from 2006 until about 2016. And then I became a regional clinical advisor, which is North America. Okay. And then in 2018, when Pat Noonan retired, I became a global clinical advisor, and that oversees the world.
Wow.
And they sort of restructured that. It doesn't change much, but it's called a global faculty advisor.
Very good. And COVID must have had a significant impact.
Huge. We couldn't do in-person screenings, and that's where that thing I mentioned about what Morgan set up was so important. So we had some contact with the athletes. And again, a lot of it was really ended up being educational.
Very good. So let's talk for a minute about Midwestern University, because you've been at Midwestern since 2003? Five, sorry. And so right away in 2006, you got involved. And Dr. Geppinger, our president, has been nothing but supportive of all of the efforts and any requests that you've made on behalf of Special Olympics. She's granted everything, including the vaccination clinic.
Yeah.
Can you talk a little bit more about the vaccination clinic? Because that was a special event specifically for
Special Olympics, Arizona athletes. And we had, as Alicia mentioned, scribes. We had lots of scribes, as well as those that could give the actual vaccination. And Mac Morgan was a scribe also. And so she was really involved in that. But Dr. G was so proud of this, and we were so excited that she was so bought into helping. And as you mentioned, she supports us in a lot of other ways, too. We have our main fundraiser is called the Breakfast with Champions, which you've been to several times. Alicia got to go. You weren't even a student yet, almost. Or you were a student for 2 months, and then you got to go.
Yeah, I was lucky.
It was so cool. But Dr. G, of course, paid for our table, the big kids table, and then the students had their own table, which Special Olympics Arizona donated. So she got to sit with Montana and other students who've been very involved in Special Olympics. And as you know, it's just a wonderful event. I mean, speeches, and it's just, I could talk all day about it. It's so cool.
So David, you've been able to get a lot of the faculty involved. And I think that's super important, because that way we can get coverage to all the different events. How many different events do you think our school is represented at a year for Fit Feet?
We have two major events. The winter games, well, actually winter is one of the major ones. We have the fall games, which will be in October, and we have the summer games, which are in May. We are always bothering them to try and find another smaller events to do. And fortunately, we were able to go up to Flagstaff for the winter games, and that was one that Alicia and about 4 or 5 of your classmates, they were all first years that went. And they did fantastic. I was really, really proud. And we had a former graduate of our school, Rachel O'Connor, who's in practice in Flagstaff, and she came and oversaw the event. So it was just a blast.
So how many athletes do you screen in an event like that?
It depends on the event. The spring games, the May games, we'll see up to 200. And then the fall games, maybe 100. We saw maybe 30, I'd say, in Flagstaff.
Well, what are some of the pathologies that you see in this group?
How much time do you have?
Well, we can do as much as you want, but I think it's interesting because our listeners for sure would like to know.
We see things that you don't see in the general population. I'll give you a quick example. I had never seen brachymetatarsia, which is that short metatarsal deformity frequently seen in Down syndrome. We see at least 2 at every event. We see tremendous degrees of flat foot, bunions, lots of things that are hygiene related, tinea pedis. We see a lot of gait disturbances because a lot of people think, well, special Olympics is just Down syndrome. It's not. It's lots of other intellectual disabilities, and some of them are related to cerebral palsy, which, of course, can cause contractures and just the opposite of the flat foot hyperflexibility that we see.
Wow. So when you gather all this data, right, we're collecting lots of data like Morgan was doing during COVID, I remember. How do we take the data and translate it into care?
Oh, that is the golden question. The people that sponsored that award, Golisano Foundation, he's given millions and millions of dollars for healthy athletes. Okay. And the big question they have every year is, so what? What are all these screenings leading to? And so what Special Olympics major, push right now is follow-up and referrals. What's happening to these athletes that we find have a certain significant condition? Are they getting the care? Are they getting better? And they've really streamlined that process of data collection. So let's say, again, just if Alicia was an athlete, she comes through in 2007, we do her screening, and then she comes back in 2008. Now you have a redundancy of that. So it corrupts the data. So they're finding ways that she doesn't get counted twice,
right.
That kind of stuff.
That makes sense. And it makes sense to have the natural referral networks available. And I'm sure that grows over time too.
Mm-hmm.
I wanted to bring up, speaking of fundraising and Special Olympics, you're kind of famous for what's called the polar plunge here in Arizona.
I don't know if I'm famous. It's a fundraising thing. And one of my Special Olympics Arizona folks that I've known forever, and she was actually head of health for many years until Gianna took over, was Amanda. And we both have our dogs that we love, and so I talked her into joining me for the polar plunge. So, and Julie, my wife, went as well, and we had an ASU camera person that wanted to videotape this whole thing. And so we went to Lake Pleasant in February. The water was about 50, but the wind was 50 miles an hour. And so Amanda got her dog and ran in there and jumped in and jumped out and da-da and just did a great job. I pretty much just fell in.
Didn't you have like flippers on and things?
I had flippers on, and I didn't realize that you have to back your way out of the lake. And so I couldn't get out of the lake. I kept falling down, and I was probably going to drown. So Kylo, my dog, actually pulled me out of the lake.
Maybe I should have said you're infamous for it.
What's that?
Maybe I should have said you're infamous.
Definitely infamous. But we got it done, and we froze, but we went to a really nice burger place afterwards.
Well, Alicia, we're kind of soft here in Arizona because you did a polar plunge in Michigan through the ice, if I'm not mistaken.
Actually, that wasn't me. I was too big of a scaredy cat. But so my uncle has this pond, and he drilled a little hole, and it was like in the middle of winter, and both my husband, my brother-in-law, and my brother both jumped in this tiny little ice hole, and it was crazy.
So it was like 32 and a half degrees.
Yeah, somewhere like that.
We talk about weather. Here we are in Arizona. It's 110 outside today. So no ties, no sport coats. Just here enjoying the discussion in Scottsdale. So one other event that you and I did a couple of years ago, it was another fundraiser for Special Olympics. They have an event where we rappel off the city center in downtown Phoenix. How many stories was that?
It was 450 feet.
Yep, and you and I did it together. Yeah, that was pretty incredible. That was kind of, when I looked over the edge, I wasn't so sure what to think.
And that's what it's called, over the edge. And I should mention, I had never done anything like that. And they go through the whole training process. You actually do a little practice thing in a safe area. And I had my GoPro on, which was really cool. I should mention Dr. Jensen has done much of this for real, like El Capitan and some actual real rappelling. So, but it was great. It was lovely. I thought I'd be scared, but it really wasn't that scary. I didn't think.
Yep, it was a great event. What a phenomenal event, and raising money for a great cause. I think right now we should commit to doing it again this year. All right, I'm in. Alicia?
I'm in too.
All right.
Are you ready?
Yes.
All right. That's good.
That sounds great. All right. Well, let's move on just a little bit. I wanted to talk, Alicia, a little bit about your relationship and the presidency, because you're busy. Not only are you in school and not only working with the AADMD, but you're also with ELPS, the Limb Preservation Association. How's that going?
So I haven't done a whole lot. I was just elected this summer, but I'd really like to work with the wound care president to do a biopsy lab, probably in the fall, just because we're all kind of busy, and then the third years are taking their boards. But yeah, I'd really like to do something like that, and then maybe do something for September, which is PAD Awareness Month, which is really big for the American Limb Preservation Society, like as a whole.
And that's interesting. There may be some overlap there, especially when we start talking about the prevalence of diabetes in the Down syndrome population. So that's kind of neat. Maybe unexpected coincidence, really.
Yeah,
so
yeah.
that's really neat also. Well, very good. So what other events do you see coming up in the future for Special Olympics at the school?
Well, one thing that we did, I don't know how many years ago, I'll just say 2017, just to ballpark it, was we set up an event, a Special Olympics Fit Feet event at Navajo Nation.
That's right.
And this is when Dr. Page was the dean before you, and Dr. Weiland went, and Dr. Page, and one student. We were only able to get one student, and I think it was set up with the Chinle High School, and we had all the Chinle High School football team are the ones that set up the venue. It was mainly bocce. We maybe saw 30 or so athletes. McQueen, I think, was involved. She's our only Native American graduate, I believe, from the program, and she's in practice up there. And Rachel I think Rachel was there too. Rachel O'Connor, who's obviously from Flagstaff, not too far away. And it was absolutely the most amazing experience. The very first Special Olympics Healthy Athletes event in Navajo Nation, and it was Fit Feet.
Wow.
And no one else went, just Fit Feet.
Wow.
So I keep bugging. Summer is her name's Summer, and she is the new health director for Special Olympics Arizona, and she's the one that supervised our trip to Flagstaff, and would just wonderful job. Every time they switch these health directors, I go, oh, geez, not knowing if they're going to be up to the quality. Like when Amanda went up the notch and Gianna became, I'm thinking, oh, how can anybody possibly replace Amanda? Well, Gianna was just great.
That's fabulous.
And, a funny little quick story about Gianna. Her very first event was actually a hike up in Flagstaff. And so I went up there with Kylo, and we're just hanging out and just having a great time. There was a bear sighting.
Wow.
So you got all these athletes having this hike, and there's a bear sighting. And then an athlete wandered off and got lost. And I'm thinking I'm going to have to get Kylo to go find this person. But they found the kid very quickly. But what a great way to start, But she has been absolutely fantastic. All of them are. I just can't say enough about Special Olympics Arizona.
Well, thank you for your leadership. My gosh, you've been a one of the continuums for so many years now, and it's just amazing the number of students that have been involved and now practitioners. So that's phenomenal. Alicia, I have a couple more questions for you, being a new second-year student at the Arizona College. How did the first year go for you?
It was good. It was definitely very hard. Fall quarter was a little tough for me because trying to find my study habits. I did like nothing but study. I didn't run very much. I didn't like take time for myself, and that was really hard. So during winter quarter, I actually was like, okay, I'm going to make time to run. I'm going to make time to spend time with my husband, and it just went a whole lot better. Just taking that time for myself just made a huge difference in my studying, and it made it more efficient, and it went a lot better.
Did you have to change your study skills significantly from when you were an undergrad to accommodate for the increase in volume of information, or what was the trick there?
Yeah, I did. Since undergrad was so long ago too, it also took me some time to like actually get back into studying. So I would say yes.
Our new class is coming in 4 weeks for orientation, and classes start in 5 weeks. What recommendations would you have for a student that's starting out in our curriculum next month?
So a big tip, like I just mentioned, making sure, even though it is a lot of studying, to take time for yourself to continue doing your hobbies that you enjoy, but also to do study groups. That's a big help for me, is getting together with somebody like one time before the exam and just quizzing each other and going over things on the whiteboard. That was really helpful for me. But of course, one person's study habits doesn't always fit for the next person. So also making sure you're doing your own thing and doing what works best for you.
Well said. So when you started a year ago, your first 2 big courses were anatomy and biochemistry. And of course, we had a PodMed course there. But you had mentioned to me earlier that you really enjoyed physiology, which started the second quarter.
Yes.
So that's a pretty heavy load then, starting with the second quarter going forward.
Oh, yeah. Very much so.
What was it about physiology that you liked?
I just liked that. I don't know, it came a little easier to me. With anatomy, it's a lot of memorization, but with physiology, I can read the slide, I can understand it, and then that helps me remember it for the exam. And like you kind of mentioned on the card right here, it's just like a story. So It makes it easier.
It does make sense. You don't have to memorize quite as much.
Right. Yep.
Well done. Getting through that first year is the hardest part of becoming a doctor. So congratulations.
Thank you.
Well done. So David, we're going to move into one of our new sections on the Dean's Chat, and that's the Amateur Psychology 5 minutes. And you filled out the Big 5 personality test.
I did.
And you even forwarded them to me.
I did.
Yeah, thank you.
I don't know if that was a mistake, though.
No, I think it's interesting because of all the Big 5 personality tests, it's no surprise where you ranked very high. Extroversion. Go figure, Dr. Jenkins, right? The 2 parts of extroversion, and where you were highest was in enthusiasm. No surprise to me. How do you think that enthusiasm's impacted your career?
Well, significantly. I hope the enthusiasm is catching, like things in Special Olympics, and not just Special Olympics, but even the academics. I think today we, and Alicia participated in what we call a CBE, which is a test. It's a practical test where they have to demonstrate how to do certain, in this case, biomechanical exam techniques. And I just think when we were done, and the students all in my groups just did so good, and just to really get them excited and enthusiastic about how this parlays into their actual clinical experiences. Just silly things like when you go to a new clinical rotation, go into the room and figure out how to use the chair. Because nobody could figure out how to use the slider that's underneath. It sounds silly, but you're not going to look real sharp if you don't know how to do this stuff in the room. So just that kind of thing, that's what I like to share. I want them to be successful.
Well, your enthusiasm is infectious. There's no question about that. I would also like to comment on your compassion scores, which is also no surprise in your work with Special Olympics. And then we all know that you were going to score high in the intellect part, so that's no surprise to anybody. And then also you're assertive, but you're not as assertive as you are enthusiastic. So I think that's part of extroversion, right? enthusiasm and assertiveness, and your enthusiasm pushed that right off the charts. So congratulations to you. Now here's a question for you. Is your enthusiasm, were you born enthusiastic about things, or did that come with time?
It came with time. Yeah. I mean, we can get really into the deep psychological stuff, but I was born with very, very severe farsightedness. Oh. So I'm one of those guys like American Graffiti, the geek in the show with glasses that thick, and everybody called me Four Eyes and all that kind of stuff. So I think that really stunted my self-image, I guess.
Well, that's interesting.
Yeah, until I got contacts. And then it's like, whoosh, everything changed. Okay. I suddenly became much more outgoing, much more comfortable, much more better self-image, and then sports. And this is where I relate so much to Alicia. Running was my life. I mean, I did track from 5th grade, and I'm still muddling through right now, but I was very competitive, was a state champion in a relay in California, and I was more of a sprinter. She's more of a distance runner, and I don't really, I can't get off on that pain that
you're still winning age group awards, so I mean, you're incredible.
For my age group.
That's what I mean, age groups, yeah, absolutely. Alicia, tell us about your college running career.
Ooh. Well, that was where I met my husband.
Well, enough said, right there.
Give him a shout out. But yeah, I loved it. I am so glad. I wasn't actually going to join cross country. I was like, no, I need to focus on my studies. But my mom and dad kind of they're like, no, you need to do something. It's like a great way to find friends. And they were so right. Like, I made some amazing lifelong friends as well on the team. I loved cross country. I got to do 6Ks in the hills and all the dirt in the mud, and that was my favorite. But for track, I got to do the 5K and 10K, which the 10K took a little bit of time to get used to. It's 25 laps around the track, so it's a lot of mind games, making sure you just keep going even when you want to stop. But yeah, I loved my track career, and my cross country career so I like to keep that up going today, and still running, try and do like 30 miles a week. But
wow, good for you.
Thank you.
She's very competitive. She's going to be humble here, but she is a top runner. Like in a major race, she'll usually win the 5K open.
Thank you.
And her husband's even better.
Wow. Congratulations.
She is amazing.
Well, that perseverance and intestinal fortitude will just serve you well, as you probably already found in the medical school curriculum.
Yes.
Especially as you progress towards residency.
Oh, yeah.
I really strongly believe that if you could be a distance runner, and I've always said this to would-be applicants, students, and who are athletes. And it doesn't have to be running. It could be basketball. I said generally they really do well in our curriculum because they have that ability to sit down and just get it done and work hard. The work ethic is off the charts for elite athletes. As you know, we've had students who were professional ice skaters. I had a McDonald's All-American student at Des Moines that's big time.
For sure. Speaking about success as a first year, I always talk about time management skills, because if you can't manage time, you really struggle. And I think students that had participated in sports in college were forced to maintain a schedule, and they've already kind of honed those time management skills, and they come in with an advantage right out of the gates. No doubt about it.
They do.
Well, anyways, congratulations on these wonderful scores. Nothing that we didn't expect.
It was fixed.
So we're getting near the end of the interview. So I wanted to see if you had any last comments, about the college or podiatry or prospective students. David, the floor is yours. What do you want to talk about?
Well, again, the success that we've had, I think, at Midwestern is because of the students. I mean, when you have the new class that comes out in a few months, and we have that fall event, every single student in that class is going to want to go to Special Olympics. They're so hungry to do something clinically. They're just, biochemistry and histo and all that stuff. And so, oh my God, we can go out and actually do something clinically. I usually do, and now Dr. Curtis's class, a little, hey, this is what Special Olympics is, and go through what you do, the process, so they know what to expect. And we get a tremendous number of students that sign up for it. And so that's been just a godsend for the success at Special Olympics Arizona. And the fact that we have other disciplines represented in Special Olympics Arizona from Midwestern. Dr. Feist, who's Alicia Feist, is the dean, and she's an opening eyes clinical director. So she takes students and they do eye exams. We've got Suzanne O'Neill, who is Fun Fitness, which is the physical therapy component. She takes tons of students, and sometimes we share students because the physical therapy students, they know quite a bit of the kinds of things that we do at this event. And that's always a blast to have that interdisciplinary thing. And clinical psych gets involved in Strong Minds, where the athletes are actually assessed for, their anxiety levels and focus and things that go with sports psychology. I know I'm forgetting some dental. Dr. Kara, she brings dental students and they do a dental checkup, and these are all Midwestern programs that are involved in this. So, and of course, many of them are at the Breakfast of Champions at our table, those clinical directors.
Well, it's unbelievable, and you are a driving force in that, David. Thank you so much. On behalf of everybody at the university, and the students and the athletes, it's just truly incredible. And any last words, Alicia?
I would just recommend for everyone to get involved with Special Olympics. It's so much fun, and to be able to learn those communication skills so your practice in the future can be more inclusive to patients with intellectual disabilities. I think it's super important, so I highly recommend volunteering as early as you can, which is our first year after fall quarter.
Well done and well said. And thank you both for your coming onto Dean's Chat and sharing your stories and your time and energy. And again, David, congratulations on this, like a lifetime honor. It's just incredible. Well done. And to all of our listeners out there, thank you so much for tuning in to Dean's Chat. We will continue to bring you topics of all things podiatric medicine, and we're going to bring leaders and future leaders onto the show as often as possible. If you're watching on YouTube, don't forget to subscribe. And if you're listening on Spotify or Apple Podcasts, please give us a 5-star rating. Until next time, cheers, everyone.